So I've got a fun story to start off with. Lindsay was an intern in our office way back in 2009
yeah.
and 2010. You went to McDaniel College,
Yep.
which is now McDaniel University. Was your college in that book, 40 Colleges That Make a Difference? How many know that book, 40 Colleges That Make a Difference? They're the small ones. So her college was in it. So now, 2009, 2010, 7 years later, this young lady is now one of the national experts on Medicaid, okay? So I feel really good to know that the future of Medicaid is in the hands of someone like Lindsay Browning. So this half-hour lightning round session is going to be an attempt to, again, educate you at the 10,000-foot level about what Medicaid is and why it's important. And there's actually a fact sheet in your folder, so please pull it out while we're talking. But more importantly, listen to the questions that I ask Lindsay, and then try to digest exactly what her answers might be. So Lindsay, I guess the first question out of the box, what is Medicaid versus Medicare? Explain to the group what the program is.
This is a conversation I have with my family all of the time. They're like, Medicaid, what is that? And they still think I work on Medicare, but it's a different program. So Medicaid is the lesser-known sibling of Medicare. It was created in 1965 at the same time as Medicare, but covers really a different population. Covers the low income, those with serious complex medical needs, individuals with disabilities, that sort of program. And it's a lot like the insurance you get through your employer, right? I imagine that's how a lot of us are covered, but it's a public program. And it's really designed to meet the needs of the population it serves, and the benefits designed that way. I think the other really interesting thing about Medicaid that people often don't realize is that it's actually jointly funded by the federal government and the state governments, and it's run by the states. So the feds set broad rules for how the program is run, and then the states kind of tailor the program to the populations that they serve. So it's really an interesting program.
So Medicare is for seniors, and it's only paid for by the federal government.
Yep.
Medicaid is a partnership between the feds and the states. So everybody got that? So how did Medicaid become more important more recently?
So Medicaid has really grown in size and in its role in the health system. So the Affordable Care Act, or Obamacare, allowed states to cover childless adults under the program that have low income. And prior to the Affordable Care Act, very few adults were covered. Very few childless adults that had low income were covered through Medicaid. So the program has taken on a bigger role in serving those with lower income. And I think for your all's purposes, this population have significant mental health and substance use disorder needs. So the program has become a major payer for those populations.
Exactly. Some of the facts that Lindsay shared with me, 1 out of 4 people on Medicaid have a serious mental illness, and 1 out of 5 people on Medicaid have some form of mental illness, and nearly 1 out of 5 people on Medicaid have an addiction issue. So talk with us about how the current debate in Congress, they added this new group, childless adults.
Yep.
Some states accepted more funding from the feds. Some states chose not to. So give them the man and woman on the street sort of like, what the heck was going on?
So the Affordable Care Act, again, Obamacare, actually required all states to expand coverage to this population. But then in one of the Supreme Court cases, when they took a look at the Affordable Care Act, they said it's actually optional. So some states have taken up the expansion, and some have not. So that's why you see some differences from state to state in how many of these adults are covered through the Medicaid program.
So what if they phased out or curtailed Medicaid? What would happen, do you think? Can you give a scenario, at least some of the scenarios that might happen?
So let me back up a little bit and
Sure.
maybe just talk a little bit about what they're talking about on the Hill. There are two things I think that are important to note. The first is that they're talking about phasing down this expansion to childless adults over a series of years. And it seems like the debate is really about how much time to take to phase it down, not whether or not to get rid of it. And the second piece they're talking about is whether there should be a cap on the amount of money the feds will kick in to Medicaid over time. And I like to think about the way the federal funding and the state funding flows into this program, kind of like, when you give money to a charity, right? And a company like Walmart says, we're going to match it. We're going to match, through $2 for every dollar you put in, or $1 for every dollar you put in. That's kind of how this funding with the states and the Fed works to Medicaid. So the other piece of what they're talking about is limiting how much the feds will kick in to the Medicaid program over time.
Yeah, and I think you shared with me, Lindsay, that in 2015, the Fed spent, or their contribution was $500 billion, right?
The total program was $500.
The total program. Mm-hmm. There are some discussions about cutting that by 25% over 10 years. So that's the crux of the, so without the federal funding, again, what are some scenarios? Are the childless adults, you think, the first people that might?
Yeah, so if you're talking about this money, the money to the states for covering these childless adults, if that goes away, I think there's going to be some really difficult conversations at the state level. One thing that could be considered is covering them with state-only dollars, but as a lot of you probably know from talking to your state legislators, that state budgets are very, very strapped right now, and to be able to do that, I think, would be a huge lift. Other options are not discontinuing coverage for this population, or phasing it down, or thinking whether there's a more narrow benefit package for this population, those sorts of conversations. So there would be a lot of difficult conversations at the state level.
And the interesting thing is that Lindsay's organization, they're nonpartisan too. They can't get involved in saying, spend more money on Medicaid, spend less money. Tell us about your organization.
Yeah. So I work for the National Association of Medicaid Directors, and we are essentially the trade association for the Medicaid directors in all 50 states, DC, and the territories. So our members work for the governors. So with a lot of these very political conversations, we see it as being above our pay grade. But Medicaid directors really know what it takes to run the program within a set budget, and are really seeking to provide operational insight and expertise into this conversation. So saying, okay, if you're going to cut this, these might be some of the operational considerations the states would have to make.
Medicaid apparently is called different, has different names in different states, so tell us about that a little bit.
Yeah. We often say that, Medicaid is really challenging to talk about and to advocate for, because the program looks different in every state, and it's called something different. So if you're from California, I don't know if we have any California folks here, it's Medi-Cal in your state. If you're from Oklahoma, it's Sooner Care. So it's different, and I've talked to people about Medicaid. They have no idea what it is, and then it turns out they're on Medicaid and receiving benefits through it. So it's challenging to talk about with your members of Congress and even friends when they don't know what the program is.
Yeah, exactly. When we had lunch a couple of weeks ago, tell them about your metaphor about the bumper sticker.
Yeah. So, when you're talking about Medicare, right, it passes what you call the bumper sticker test. If you could fit Medicare on a bumper sticker, it would be old people, right? If you had to put Medicaid on a bumper sticker, what would it be? Disabled, low income, children, pregnant moms. It's really difficult to fit on the bumper sticker, and that's why I think it's hard to talk about.
Yeah. The other thing you and I talked about, she actually gave me a graduate school briefing on Medicaid. You guys you do continual studies, right? So one of the important features of Medicaid is the coordinated care that goes on. Do you want to chat with the group about what that means and what, in terms of savings and quality of life for people that are on Medicaid?
Yeah, so for people on Medicaid, it's an insurance product, right? So you're receiving your physical health care, your mental health care, your substance use disorder treatment, all through one insurer. And something that state Medicaid programs bring is that they're trying to coordinate and integrate that care, so that if you have a behavioral health need, those doctors are also thinking about your physical health services and talking to one another. And so in a lot of ways, having coverage is a way to get better outcomes because you're looking at the whole person. And that's what Medicaid programs have been doing and innovating in ways to better deliver that care.
Okay. So I don't think I asked you this question, and hopefully you can answer it. If you're a new member of Congress, you were just elected last November, what do you think the biggest misperceptions, not just among lawmakers, but about the general public too, about Medicaid? Is it a freebie that's an extra that people who don't really need it are taking advantage of the system? Or how would you describe, and again, I think you sort of touched on it, that there are millions of Americans that need this coordinated care. Mm-hmm. Somehow, some way, it used to be if you were a childless adult and you didn't have Medicaid, you would more often than not end up in the emergency room, right?
Yep, or and you would go for a one-off service at a clinic.
Right, so then you deal with one issue at a time, and back to your point about the coordinated care. So it's actually, is it fair to say that this program is probably saving dollars in the end?
I would hesitate to make a global statement like that, sure. But I think there's plenty of research that shows that Medicaid improves health outcomes, having coverage. And when we're looking at, the opioid epidemic in this country, that there's no other place where these individuals can get treatment. Medicaid is providing coverage for these populations in a lot of cases. So I think that's the misperception, right? Is that Medicaid works and it's better than being uninsured. It provides effective, efficient coverage for these folks.
What if I'm a childless adult? What type of requirements would I have to bring to the table in order to get the care? Could you just give us a brief sketch of what a typical childless adult looks like?
Sure. So your income would have to be under 138% of the federal poverty level, which I believe is like maybe less than $20,000 a year.
Okay.
And so you'd have to meet that income requirement. If you don't meet the income requirement, the other way you can be eligible for Medicaid is through disability.
Okay.
And so there's a different process to determine if you meet those requirements.
So there's also a disability category, mm-hmm. and then there's a children's category.
Yep.
Is that a good way to look at it? So
yeah.
It's really three prongs. Is that a fair way to look at it?
Yeah, and the children's is often based on, again, it can be based on income or disability.
So you could have a family where a child may be on Medicaid, but the parents don't qualify, mm-hmm. or they have some other way.
Yeah, and the program's always been, traditionally it's been more generous to kids, low-income kids, than right. to adults.
Are there any questions from the audience? Anyone writing down questions on index cards? Because again, this is going to be important for us because, so while we're contemplating questions, what advice do you have for our advocates? Again, back to your point that it doesn't fit on a bumper sticker, mm-hmm. but we do want them to go to the Hill tomorrow and to be able to articulate why current Medicaid programs should be continued and why they're important.
Yeah, I mean, the first thing I would say is don't be intimidated by talking about the program. John oversold my expertise because I think the truth is you can work in Medicaid for 40 years and you don't know everything about it, right? It's a complex program, but it's okay. And it's okay not to know everything about it. Chances are the people you're talking to on the Hill really don't know that much about it either. So, don't worry about that. The second piece of advice I would say is, the more you can put a face to it or a story to Medicaid, that's really effective. If you know somebody who's received treatment through Medicaid for mental health or substance use disorder, that's effective. Or even talking about your own experience and why health insurance coverage was important for you to get treatment. I think that's another effective way to say, similar to how I've gotten treatment Medicaid also does that for other folks with serious mental health needs or other needs.
Okay, we have a couple questions from the audience. So the first one, if a state did not accept the Medicaid expansion, is it worth bringing it up with our House and Senate members tomorrow, since the decision was made by the state legislatures not to accept it?
So that's a tough question, but I think the fact is that a lot of the conversation about expansion is still going on in states. And, states are still considering adding it even if they haven't at this point. So I think it is probably still a conversation worth having with your folks.
Okay. And then I have another question. How is Medicaid different, and I can't quite read the handwriting, than coverage from the ACA exchanges?
Gotcha. I like this question. So Medicaid is a public insurance product, whereas the exchanges give you a subsidy to go purchase a commercial product. So when you have the subsidy in the exchange, you're basically going out and buying a product, and that's helping offset the cost of it.
Okay, cool. These are some great questions coming in now. This is a great question. Isn't the downside of Medicaid that you may be denied access to quality care?
So this is something we hear all the time, is that there's not sufficient access in Medicaid. And I think there are challenges, but oftentimes you see the same challenges in the commercial market. Psychiatrists is a big problem, but there's a workforce shortage in general, so that's something that even commercial insurers have to deal with. And I think there have been lots of studies that have showed improved outcomes, when you have Medicaid coverage versus no insurance coverage.
Does your website have information for people that want to do some more research offline?
Yeah, our website, the Kaiser Family Foundation, is kind of the go-to source. There's the Medicaid and CHIP Payment and Access Commission, or MACPAC. And they do a lot of nonpartisan research and aggregating of this sort of information.
Yeah, I think we included in their packets the one pager I showed it to you from the Kaiser Family Foundation, and Lindsay thought that was a pretty good representation of the program scope. Another great question. Why did some states opt to expand Medicare coverage and others didn't?
So probably Medicaid coverage is what they're referring to there?
Medicaid, I'm sorry.
So I think there's a lot of reasons. I think there are some political questions, again, to be debated above my pay grade. But I think also states looking at the cost in the long run of, there is a state portion of the expense for that population and coverage. So I think that was a big piece of the debate and discussion as well.
Okay. A lot more questions here. Okay, good question here. What happens when you don't qualify for Medicaid because you make more than the maximum income, but you can't afford Obamacare or other independent insurance?
I think that's a problem. And that's been a lot of the debate, right, with the exchanges or the Obamacare exchanges, right, is what is affordable coverage, and is that tax credit that helps you go purchase a commercial product, is that enough? And I think that's the same debate that they're having on the Hill again, right, is this new way of subsidizing commercial insurance, is it going to be enough to make it affordable? And I don't think there's an answer to that, but certainly lots of opinions out there on what makes it affordable.
Okay, here's a really good question, because it speaks to telling your personal story. What might be a specific ask in terms of keeping childless adults eligible for Medicaid? I lost my father to suicide prior to the ACA. He was a childless adult. Had he had coverage, he would have received treatment.
So the question is, like, what?
Yeah, so when you're going in, I think it's probably more of a political question. I don't want to put you in an awkward situation, but if you've got disabled folks, you've got kids, disabled folks, and then childless adults. When you start looking to make the cutbacks, somehow childless adults seem like they're more able to take care of themselves when in fact they may not, right? So
Yeah.
it's a stark choice, right? And that goes back to, I think, your answer about the value of the program and that the coordinated care for both mental health services and addiction services, I mean, those are real issues that need to be dealt with, and it's going to cost the government money down the road somehow, some way, whether it's through the emergency room, if they're able to find a clinic. Most of us know, Bob talked this morning about Project 2025. You all know that our jails have now become, de facto mental health hospitals, and most of our prisoners are not receiving any kind of care. So it's a tough thing to talk about. So what are your thoughts, without getting you in trouble, in terms of what do you think?
So here's the thing, Medicaid is one piece of insurance coverage in this country, right? And so I think the answer is, well, if not Medicaid coverage, then what? Like, it goes back to that earlier issue. Then can they afford to purchase coverage on the exchange or whatever commercial insurance product is out there? Can they get it through their employer? So I think it's recognizing that we need to be talking about the fundamental problems of making insurance affordable in this country if you're gonna make changes to the safety net program.
Okay, here's a new aspect that I don't. I guess you and I hadn't talked about. I guess it'll be a second thesis class. I understand that patients will have a choice between fee-for-service Medicaid and managed care Medicaid, such as Aetna Medicaid. Are there more benefits that managed care Medicaid can provide than fee-for-service Medicaid? So can you sort of break that down and explain to people what that means?
I'll try breaking down fee-for-service and managed care
Right.
Medicaid, because I think it's important. It gets into the weeds a little bit, but so fee-for-service Medicaid is when the state directly contracts with individuals' providers to deliver care for beneficiaries. But a lot of states, actually the vast majority of states, use what's called managed care. And essentially the state contracts with a company to deliver services to those beneficiaries and ensure that they're receiving coordinated care. So it's essentially the state partners with a third party to kind of deliver those services. Does that make sense?
Can you comment on the economic advantages to states accepting Medicaid expansion? What do you think?
I don't know if I could provide the expose on that one, but I think some of the benefits that some states have found is that if they were already paying for certain services for those individuals in clinics or otherwise, it's actually been cost effective for some states to accept the federal funds and to provide them coverage instead of, again, the one-off services for uninsured populations.
Here's a great question. If my state didn't expand Medicaid through the ACA, what happened to that money?
So that money was part of an entitlement. So it wasn't an appropriation each year that Congress sets. It's just kind of a stream of money. So that money is still there right now. But again, that's what they're talking about changing. Okay.
And then I think the last question from the audience, this is sort of a long question. Can you speak to this issue regarding children who are deemed eligible under the disability category, but who have parents over the income level? So it's not income-based. Example, in our state, children with autism qualify despite having parents whose income is over the level, but a child or teen with major depression usually does not qualify. It's complicated, but can you comment on why a developmental disability would count and not a mental illness?
So
That's a really,
yeah.
that's a, wow.
Let me break it down. You're gonna have to remind me probably
Yeah.
of the pieces of this conversation or of the question. But the first thing is there are these things called waivers in states where they can cover certain populations who would otherwise not be eligible based on their income, but because of their health needs, they can spend down into Medicaid coverage. So it's kind of again a safety net for people with really complex conditions. Now, as far as autism versus other other conditions.
Yeah, so it's autism apparently qualifies as a developmental disability versus major depression that does not.
I think that would get down into a state level conversation around how they design the waivers, and I think it would be a state by state issue.
Yeah. So this is complicated. So we now know why President Trump said healthcare is more complicated than he thought. And I'm not trying to be mean. I'm just I mean, this is like in the weed kind of stuff. So we're going to wrap up. So back to what you and I talked about at the end of our lunch. So what advice do you have for our advocates tomorrow? Obviously, Medicaid is on our list of asks. It is complicated, but what's the best way to go into an office and discuss it?
Yeah, I mean, as I said before, putting a face to the program and trying to help them understand why Medicaid coverage would be important to an individual with mental illness or substance use disorder. And I think, again, asking the question, if not Medicaid coverage, where are these folks gonna go?
Good, because again, I told people earlier before you got here that if you're from Maine, West Virginia, Arkansas, Ohio, Alaska, Nevada, some of the states that have a big Medicaid population, like my new home state, nearly a third of West Virginia residents are on Medicaid. So that's clearly why Senator Manchin and I think Senator Shelley Moore Capito has taken a much more public stance. So this is my conversation, not yours, but we have 8 Republican senators that hold in their hands potentially the balance of where the Senate might go. So it's really important that those folks, I think it's important that all of you discuss with all of your senators why Medicaid's really important. But in those 8 Republican offices, it's essential that you let them know, A, thank them for their interest and their leadership, and then ask them how you might help them. You might go back to your state and organize people that are currently on Medicaid, and they could write letters to your senators, one-page letters or emails illustrating how they get coordinated care, what it means for their quality of life, how it lets them go back to work and take care of their families. I think those are the kinds of things that need to be communicated, right? That it's a program that works, there's value, and why take something away that works? I think would that be the essence of what, and especially for people with behavioral health issues, it's especially effective, again, because of the coordinated care between physical and mental health.
Absolutely, and I think something we're seeing more and more of is states are looking at ways to use Medicaid as a launching pad to get folks back on their feet. So you may see a lot of talk about adding a work requirement, and I think that really comes from a desire to really help people live a full life, and I think that is a message that resonates well with folks.
Okay, one final question. Maybe you can't answer it, but maybe you can. Someone wrote in, is Medicaid a good blueprint for universal health care?
This one's way above my pay grade.
Okay. I understand. So with that said, you see now why I do think you're an expert. She knew more when we had lunch. I know more now, but I think all of you now have a better idea about how Medicaid works compared to Medicare, And you can start thinking, as we talk today, there'll be other conversations with threads around opioids and essential health benefits. So thank you, congratulations. We are so proud of you.
Thank you.